My name is Patrick McGahan, and this is a presentation on the operative treatment of Achilles tendon ruptures. I am a board-certified orthopedic surgeon that practices in San Francisco, California. My specialty is sports medicine and injuries such as Achilles tendon ruptures. This presentation will involve a discussion of the anatomy, the function of the Achilles tendon, causes of ruptures, operative treatment, non-operative treatment, standard postoperative protocol, and a real patient case. The Achilles tendon is the largest tendon in the body. It is formed from the gastrocnemius muscle and the soleus muscle. It inserts into the posterior calcaneus. The Achilles tendon is responsible for forceful plantar flexion, which results in dynamic movement of the foot and ankle. There are multiple causes of Achilles tendon rupture. However, the bottom line cause is a strong force that overloads the tendon. This can happen with forceful contraction, such as sprinting or jumping, or eccentric overloading, such as stepping down backwards or landing from a jump. This also can be a chronic overuse injury, but most typically is an acute traumatic injury. The typical presentation of Achilles tendon rupture is an athlete who feels a sudden pop in their back of their leg. Often, the patient reports that they felt as if someone kicked them in the back of the leg or as if a ball hit them in the back of the leg. The initial injury is not typically painful, although pain typically sets in an hour after the injury as the swelling starts to increase. On physical examination, there is a palpable gap in the Achilles tendon at the location of the tear. A positive Thompson's test indicates an Achilles tendon rupture. Non-operative treatment is typically reserved for patients with multiple comorbidities, such as those patients who are diabetic and who smoke tobacco. Non-surgical management consists of immobilization in a posterior splint with a functional rehabilitation protocol starting at 2 weeks. Operative treatment is the standard of care in the United States. Surgical indications are a complete tear of the Achilles tendon. This is confirmed on physical examination with a palpable gap in the Achilles tendon and a positive Thompson's test. MRI is not typically needed for the diagnosis and is not typically ordered prior to surgery. However, in cases where there is a question as to whether there is a complete Achilles tendon rupture, an MRI will be ordered. Surgical management consists of an incision over the Achilles tendon, approximately 6 centimeters in length. The tendon ends are then identified and are sutured together with a very strong, non-absorbable suture called fiber wire. Following this, a patient is placed in a splint for 2 weeks following surgery. Functional rehabilitation begins at 2 weeks after surgery with the use of a walking boot. However, a patient is typically kept non-weight bearing for 4 to 6 weeks postoperatively. As stated previously, an Achilles tendon repair starts with an appropriately sized incision over the torn tendon. The tendon ends are identified with care taken to protect all neurovascular structures. Once the tendon ends are identified, they are then sutured together using a high tensile strength suture called fiber wire suture. When deciding between operative and non-operative management, important considerations are the benefits of surgical treatment. Surgical treatment results in a lower rate of re-rupture as well as a greater push-off strength. In addition, there is evidence that this results in a faster return to activity. The benefits of non-operative treatment is that one negates the risk of surgical infection risk. Following surgery, a patient is immobilized for 2 weeks in a posterior splint. At that point, a patient uses crutches. At the 2-week follow-up appointment, a patient is seen in clinic and the sutures are removed. A patient is then placed in a walking boot. However, at that time, a patient is still instructed to remain non-weight bearing for 4 to 6 weeks postoperatively. Physical therapy starts at 2 weeks and weight bearing begins at 6 weeks. At approximately 12 weeks, a patient can wean themselves out of the walking boot. At that time, activities such as stationary bike and swimming are begun. Return to sport takes approximately 6 months. However, even though a patient may return to sports and jogging at 6 months, full recovery can take 1 to 2 years. This is the rehabilitation protocol that I use that is outlined previously. The highlights of the rehabilitation protocol are that a patient is in a splint for 2 weeks postoperatively. A patient is non-weight bearing for 6 weeks postoperatively. A patient uses a walking boot for 12 weeks postoperatively, and return to sports is at approximately 6 months, and full recovery can take 1 to 2 years. Next is a real patient case from my practice. This represents a 45-year-old male who felt as if someone kicked him in the back of his leg while playing soccer. He was actually still able to ambulate and reported to the clinic, reporting that he felt that he had simply strained his calf. Upon physical examination, he had a palpable gap in his Achilles tendon and a positive Thompson's test. After discussing the risks and benefits of surgery, we decided to proceed with surgical treatment due to the faster recovery time, lower risk of re-rupture, and increased push-off strength. Surgery began with an appropriately sized incision over the torn Achilles tendon. The tendon ends are identified and can be seen here with my 2 metallic clamps. Once the tendon ends have been identified, a high-strength suture is used to gain purchase in the tendons. As seen in this picture, fiber wire suture has been used to secure the tendons. However, the tendon ends are still separated. Once the tendon ends have been sutured and mobilized, they are then brought together and the sutures are tied. This demonstrates the tendon ends being brought together and tied. Once the tendon ends have been secured, then the incision is closed. This is the standard incision as it is closed with a nylon suture. The patient is then placed in a posterior splint and is seen in clinic with the follow-up as discussed previously. Achilles tendon ruptures are common in patients of all ages and activity levels. The most common treatment for Achilles tendon rupture in the United States is to surgically reattach the tendon ends. Although non-surgical treatment is an option, it is typically reserved for patients with comorbidities such as a smoking history and diabetes. Following Achilles tendon repair, functional rehabilitation is necessary for optimal results. This is why a strict physical therapy regimen and strict communication between the physical therapist and the surgeon is necessary for an optimal recovery. With prompt surgical treatment and optimal physical therapy, patients can expect a good recovery. However, it should be noted that full recovery can take 1 to 2 years.